Welcome back, everybody. A healthy lifestyle is certainly important to anyone these days, especially people involved in the battle against cancer.
And that's why we have clinical dietitian Rebecca Egdorf here to talk about this topic. Thank you so much for joining us.
Thank you for having me.
Nice to have you here. Here we are on the cusp of the holidays, all the parties, all the great foods, people coming over. And again, a healthy lifestyle is important and a healthy diet is important all year long. This has got to be a tough time of year for folks, huh?
It sure is, because people who are going through chemotherapy or radiation are extra tired. They have a lot going on, a lot of stress, but there's also a lot of side effects to chemotherapy and radiation, such as a sore mouth, taste changes, nausea, vomiting, diarrhea, constipation, and so it can be kind of daunting to go to a family holiday with all of these side effects and knowing what to eat. So
if you have a family member battling cancer and you know they're coming over for Christmas, what are some dishes that you can prepare for them?
Sure. Well, the most important thing is providing a variety of flavors. So a lot of times people will taste different foods. So one thing that maybe tastes good to one person might not taste good to another. So spicing the food, providing a lot of flavor, and that way the person can try a variety of dishes and see which one tastes good to them. Also, a lot of people going through chemotherapy will complain of a metallic taste, and so providing lemon wedges or orange wedges or some kind of a citrus on the side that they can squeeze on their food will actually enhance the flavor and help with those taste changes.
That's a good thing to know. Does chemotherapy affect different people differently as far as it comes to taste and things like that, or is it pretty much across the board thing that changes at everybody, or does people handle it differently like they do everything else?
Well, there are different types of chemotherapy, and so all of those have different side effects, so it does affect people differently. So maybe ask that family member before they come over what types of side effects they're having, what types of foods they can taste, and if they're having a sore mouth, maybe make sure that you have soft foods, things like mashed potatoes and you know, steamed vegetables.
Do what you can to accommodate them.
Absolutely.
And also this time of year we tend to eat lots of sweets. So would you recommend more healthful foods other than sweets?
Sure. I mean, the holidays are a time to indulge, and so it is nice to have some things in moderation. Maybe provide some healthier sweet options. There are plenty of recipes on the American Cancer Society's website. You could have some fruit on the side, something like that people could eat.
Where are you guys? Are just, if you're seeing this at home and you're kind of everything, oh golly, I need to write that down. I got to remember that. Is there a place to go where you can see this on the web, or call someone and find out exactly some good ideas what you're suggesting to us today?
Sure. Well, the American Cancer Society, like I said, has some really great resources and recipes. Cancer.org. There's also a cookbook by Rebecca Katz. She's a chef that specializes in preparing recipes for chemotherapy and radiation, and so she has some really good tips for families.
Good to know. You know, if you know in your family is going through something like this, talk with them. Obviously, they realize what they're going through, so you can learn so much by just asking them what's good, what they like, what they don't like, what they can and can't eat. Nice to have you here.
Thank you
so much.
National Immunization